What if I told you that right now, as you're watching this video, there might be silent warning signs happening in your body that could indicate something serious? Signs that millions of men ignore every single day, thinking they're just part of getting older. I'm about to share with you some crucial information that could literally save your life or the life of someone you love. Did you know that prostate cancer is the second most common cancer in men worldwide? But here's what will shock you. Most men with early-stage prostate cancer have absolutely no symptoms at all. That's right, this silent threat can be growing inside your body for years without you knowing it. But there are subtle signs, warning signals that your body might be trying to tell you something important. Today, we're going to explore the hidden signs that many men dismiss as normal aging, but could actually be early indicators of prostate cancer. I'm going to share with you information that could change everything about how you view your health. This isn't just another health video. This is potentially life-saving knowledge that every man over 40 needs to know. The first thing you need to understand is that your prostate is about the size of a walnut, but its impact on your health is enormous. Located just below your bladder and surrounding your urethra, this small gland plays a crucial role in your reproductive system. When something goes wrong with your prostate, your body starts sending you messages. The problem is, most men don't know how to read these messages. Here's something that might surprise you. According to the American Cancer Society, about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. But here's the encouraging part. When caught early, the 5-year survival rate is nearly 100%. That's why recognizing these early warning signs is so critical. The challenge is that early prostate cancer symptoms can be incredibly subtle. They often mimic other common conditions like benign prostatic hyperplasia, which is non-cancerous prostate enlargement, or prostatitis, which is prostate inflammation. This is why so many men ignore these signs, thinking they're just part of the normal aging process. But what if I told you that there are specific patterns, specific combinations of symptoms that could indicate something more serious is happening? What if there were warning signs that, when recognized early, could give you the best possible chance of successful treatment? The information I'm about to share with you comes from leading medical institutions like MD Anderson Cancer Center, Mayo Clinic, and the Centers for Disease Control and Prevention. This isn't speculation or theory. These are medically recognized warning signs that every man needs to know about. Stay with me, because what I'm about to reveal in the next section will show you the first and most commonly overlooked warning sign that affects millions of men every night. This seemingly innocent symptom could be your body's first cry for help, and understanding it could be the key to early detection and successful treatment. Let's talk about the first major warning sign that most men completely ignore: changes in your urination patterns, especially what happens when you try to sleep at night. If you find yourself getting up 2, 3, or even 4 times a night to urinate, you might think it's just because you're getting older, but this could be your body's first alarm bell. Here's what's really happening inside your body. As prostate cancer begins to develop, the growing tumor can start pressing against your urethra, the tube that carries urine from your bladder. This pressure creates a cascade of urinary symptoms that many men dismiss as normal aging. But there's nothing normal about suddenly needing to urinate frequently, especially at night. The medical term for frequent nighttime urination is nocturia, and while it can have many causes, when it appears alongside other symptoms, it becomes a crucial piece of the puzzle. What makes this particularly concerning is that many men adapt to this new pattern, thinking it's just part of life after 50. They adjust their evening routine, limit their fluid intake before bed, and accept interrupted sleep as their new normal. But here's what you need to understand. Your urinary patterns are like a window into your prostate health. When cancer begins to develop, it doesn't just affect nighttime urination. You might notice that during the day, you feel a more urgent need to urinate. It's not just the frequency that changes, it's the intensity of the urge. You might find yourself rushing to the bathroom, worried you won't make it in time. Another critical aspect of this warning sign is the quality of your urine stream. Have you noticed that your urine stream has become weaker than it used to be? Maybe it takes longer to empty your bladder completely, or perhaps you feel like you can't fully empty your bladder even after urinating. These changes in stream strength and bladder emptying are significant indicators that something might be affecting your prostate. Some men also experience what's called hesitancy, difficulty starting the urine stream. You might find yourself standing at the toilet, waiting for the flow to begin, or needing to strain to get started. This isn't just inconvenient. It's your body telling you that something is interfering with the normal flow of urine through your urethra. The reason these urinary symptoms are so important is that they represent your body's early warning system. Unlike many other cancers that remain completely silent in their early stages, prostate issues often announce themselves through these urinary changes. The key is recognizing them as potential warning signs rather than dismissing them as inevitable aging. What makes this information even more crucial is that these symptoms tend to progress gradually. You might not notice the changes from day to day, but if you think back 6 months or a year ago, you might realize that your bathroom habits have changed significantly. This gradual progression is exactly why so many men miss these early warning signs. But urinary symptoms are just the beginning. In the next section, I'm going to reveal another warning sign that's even more alarming, yet many men are too embarrassed to discuss it with their doctors. This symptom involves something that happens during one of the most intimate aspects of a man's life, and ignoring it could be a critical mistake. Stay with me, because this next piece of information could be the missing link in understanding what your body is trying to tell you. Now we need to discuss a warning sign that many men find difficult to talk about, but it's absolutely crucial that you understand this. Changes in your sexual function and what happens during ejaculation. This is information that could save your life, so please stay with me even if this topic makes you uncomfortable. One of the most significant warning signs of prostate cancer is the presence of blood in your semen, a condition called hematospermia. I know this might sound frightening, but here's what you need to know. Seeing blood in your semen is never normal, regardless of your age. This is your body sending you an urgent message that something needs immediate medical attention. The reason blood appears in semen when prostate cancer is developing is because the prostate gland produces a significant portion of the fluid that makes up semen. When cancerous changes occur in the prostate tissue, it can cause bleeding that mixes with the seminal fluid. This creates the reddish or brownish discoloration that men sometimes notice and often panic about. But here's what's really important to understand. While blood in semen can be terrifying to discover, it's actually one of the more definitive early warning signs. Unlike urinary frequency, which can have many benign causes, blood in semen almost always indicates that something significant is happening in your reproductive system that requires professional evaluation. Another sexual health warning sign that men often ignore is changes in their ability to achieve or maintain an erection. Now, I know that erectile dysfunction can have many causes, including stress, cardiovascular issues, diabetes, and medication side effects. However, when erectile dysfunction appears alongside other symptoms we've discussed, it becomes part of a concerning pattern. Here's why this happens. The same nerve pathways and blood vessels that are essential for healthy erections also run very close to the prostate gland. When cancer begins to develop, it can interfere with these crucial systems. Additionally, the psychological stress of dealing with other uncomfortable symptoms can also contribute to sexual performance issues. Some men also report changes in the sensation during ejaculation. They might experience pain or a burning sensation during climax, or they might notice that the volume of their ejaculation has decreased significantly. These changes occur because cancer can affect the prostate's ability to produce the fluids that make up semen, and it can also cause inflammation that makes ejaculation uncomfortable. What makes these sexual health symptoms particularly challenging is that many men are reluctant to discuss them with their healthcare providers. There's often embarrassment or shame associated with these intimate changes, which means that crucial warning signs get ignored or dismissed. But I want you to understand something important. Your doctor has heard about these symptoms many times before, and discussing them could be the key to early detection and successful treatment. The connection between prostate health and sexual function is so strong that urologists often use sexual health questions as part of their initial screening process. Changes in sexual function aren't just quality of life issues, they're potential diagnostic clues that something more serious might be developing. Here's something that might surprise you about the timing of these symptoms. Sexual health changes often appear before urinary symptoms become severe. This means that paying attention to changes in your sexual function could actually give you an earlier warning about potential prostate problems than waiting for urinary symptoms to become obvious. In our next section, I'm going to reveal a warning sign that's so subtle, most men don't even realize it's connected to prostate health. This symptom affects an area of your body that you might never associate with prostate cancer. But understanding this connection could be crucial for your health. This information builds on everything we've discussed so far, so you won't want to miss what's coming next. Here's a warning sign that will probably surprise you because it seems completely unrelated to prostate problems. Unexplained back pain, hip pain, or bone pain, especially in your lower back and pelvis. Most men who experience this type of pain assume it's just from sitting too much, sleeping wrong, or getting older, but this could actually be one of the most serious warning signs of advanced prostate cancer. Let me explain why this connection exists and why it's so important to understand. Prostate cancer has a particular tendency to spread to bones, especially the bones in your spine, pelvis, and hips. When cancer cells break away from the original tumor in your prostate, they often travel through your bloodstream and lymphatic system to these bone locations. Once there, they begin to interfere with normal bone structure and function. The reason this bone pain is so significant is that it often indicates that cancer has moved beyond the prostate gland itself. This is what doctors call metastatic prostate cancer, and it represents a more advanced stage of the disease. However, here's the crucial point. Even metastatic prostate cancer can often be successfully managed with proper treatment, especially when it's detected early in the metastatic process. What makes this bone pain different from typical back pain is its characteristics. Men often describe it as a deep, aching pain that doesn't seem to have an obvious cause. It might be worse at night or when you're resting, which is unusual for most types of mechanical back pain that typically improve with rest. The pain might also seem to move around or affect multiple areas of your back, hips, or pelvis simultaneously. Another distinguishing feature of cancer-related bone pain is that it doesn't respond well to typical pain relief methods. You might find that over-the-counter pain medications, heat, ice, or stretching don't provide the relief you'd expect for normal back pain. The pain might be constant rather than coming and going with movement or position changes. Some men also experience what feels like stiffness or achiness in their hips that makes walking or climbing stairs more difficult. This isn't the sharp pain of a pulled muscle or the predictable discomfort of arthritis. It's a persistent, deep discomfort that seems to affect your bones rather than your muscles or joints. Here's something particularly important to understand. Bone pain from prostate cancer often develops gradually. You might not wake up one morning with severe pain. Instead, you might notice that your lower back has been bothering you more often, or that getting out of bed in the morning has become more uncomfortable over several weeks or months. The location pattern is also significant. While anyone can have back pain, cancer-related bone pain often affects the lower spine, the pelvis, and the upper parts of your thigh bones. It might feel like the pain is coming from deep inside your bones rather than from your muscles or skin surface. What makes this information so crucial is that bone pain might appear before other symptoms become obvious, or it might be the symptom that finally motivates a man to seek medical attention after ignoring other warning signs for months or years. If you're experiencing persistent, unexplained bone pain, along with any of the urinary or sexual symptoms we've discussed, this combination becomes even more significant. The good news is that modern medicine has excellent tools for detecting bone involvement, including bone scans and advanced imaging techniques. When bone pain is evaluated properly and early, treatment options are much more effective than they were even a decade ago. In our next section, I'm going to share with you a warning sign that's often overlooked because it seems so general and non-specific. But when this symptom appears alongside the others we've discussed, it becomes a crucial piece of the diagnostic puzzle. This next warning sign affects your entire body and your energy levels, and understanding it could help you recognize a pattern that demands immediate medical attention. Now I want to discuss a warning sign that many men dismiss as just being tired or stressed, but it could actually be your body's way of telling you that something serious is happening. Unexplained fatigue and weakness that doesn't improve with rest, combined with unintentional weight loss. These might seem like vague symptoms, but when they appear with other warning signs, they become critically important. Here's what's happening inside your body when cancer begins to progress. Cancer cells are essentially stealing resources from your healthy tissues. They consume enormous amounts of energy and nutrients as they grow and multiply. This metabolic demand can leave you feeling exhausted even when you haven't been particularly active. It's not the normal tiredness you feel after a long day at work. It's a deep, persistent fatigue that seems to affect your very core. Many men describe this fatigue as feeling like their energy has been drained away. You might find yourself needing naps during the day or feeling exhausted after activities that used to be easy for you. Simple tasks like climbing stairs, carrying groceries, or even getting dressed might leave you feeling winded or worn out. This isn't normal aging. This is your body struggling to maintain its normal functions while dealing with the energy demands of cancer. The weight loss component is equally concerning. When men lose weight without trying, especially when they're not dieting or increasing their exercise, it's often a sign that their body's metabolism has been disrupted. Cancer can affect your appetite, making food less appealing or causing you to feel full more quickly than usual. Additionally, the metabolic demands of cancer can actually cause your body to burn calories at a higher rate than normal. What makes this particularly insidious is that many men actually welcome unexpected weight loss, thinking it's a positive change. Society often reinforces the idea that losing weight is always good, so men might ignore this warning sign or even feel pleased about it initially. But unintentional weight loss, especially when combined with fatigue and other symptoms, should never be ignored. Another aspect of this systemic impact is changes in your appetite and eating patterns. You might notice that foods you used to enjoy don't taste as good anymore, or that you feel nauseous or uncomfortable after eating. Some men report feeling full after eating just a small amount of food, or experiencing a general disinterest in eating that's unusual for them. Sleep patterns can also be significantly affected. Beyond the frequent nighttime urination we discussed earlier, you might find that your sleep quality has deteriorated in other ways. You might have trouble falling asleep, staying asleep, or you might wake up feeling unrefreshed even after what should have been adequate sleep. This poor sleep quality then contributes to the daytime fatigue, creating a cycle that affects your overall well-being. Some men also notice changes in their mood and mental clarity during this time. The combination of physical discomfort, poor sleep, and the body's metabolic stress can lead to feelings of depression, anxiety, or irritability that seem to have no obvious cause. You might find it harder to concentrate at work or remember things that used to be easy for you to recall. Here's what's particularly important about these systemic symptoms. They often represent your body's overall response to the presence of cancer. While the earlier symptoms we discussed were more specifically related to the prostate gland's location and function, these whole-body symptoms indicate that the cancer may be affecting your general health and potentially spreading beyond the original site. The timing of these symptoms is also significant. Fatigue and weight loss often appear when cancer has been present for a while or when it's becoming more aggressive. This means that if you're experiencing these symptoms, along with the urinary, sexual, or bone pain symptoms we've discussed, it becomes even more urgent to seek medical evaluation. In our next section, I'm going to reveal something that might shock you: specific blood markers and test results that your doctor might find during routine examinations, and why understanding these numbers could be the key to early detection. This information connects everything we've discussed so far and shows you exactly what to ask your doctor about. Don't miss this crucial information that could literally save your life. Here's something that could change everything about your health monitoring. Understanding what your PSA levels mean and why they're one of the most important numbers you need to know as a man over 50. PSA stands for prostate-specific antigen, and it's a protein produced by your prostate gland. When something is wrong with your prostate, including cancer, your PSA levels often become elevated. But here's what most men don't understand about PSA testing. It's not just about having a high number. The pattern of how your PSA changes over time, the rate at which it increases, and how it responds to treatment are all crucial pieces of information that could indicate the presence of cancer long before you feel any symptoms. A normal PSA level for most men is typically below 4. 0 nanograms per milliliter of blood. However, this isn't a hard rule because PSA levels can be influenced by many factors, including age, prostate size, recent physical activity, and even sexual activity within 48 hours of the test. What's more important than a single PSA reading is the trend over time. If your PSA has been 1.5 for years and suddenly jumps to 3.8, that significant increase could be more concerning than someone whose PSA has been stable at 5.0. Here's something that might surprise you. Some men with prostate cancer have normal PSA levels, while some men with elevated PSA levels don't have cancer. This is why PSA testing is just one tool in the diagnostic process, but it's an incredibly valuable one when interpreted correctly by a qualified healthcare provider who understands your individual health profile. The PSA velocity, which measures how quickly your PSA levels are rising, is particularly important. An increase of more than 0.75 nanograms per milliliter per year could indicate the presence of cancer, even if your overall PSA level is still within the normal range. This is why regular, consistent PSA monitoring is so much more valuable than a single test. Another blood marker that doctors sometimes examine is the free PSA percentage. This test looks at how much of your PSA is floating freely in your blood versus how much is bound to proteins. Men with prostate cancer tend to have a lower percentage of free PSA compared to men with benign prostate conditions. If your free PSA percentage is below 10%, it might indicate a higher likelihood of cancer. There's also a newer test called the PSA density, which takes into account the size of your prostate gland relative to your PSA level. A larger prostate naturally produces more PSA, so this test helps doctors determine whether your PSA level is appropriate for your prostate size, or if it's elevated beyond what would be expected. Beyond PSA testing, there are other blood markers that doctors might examine. Complete blood count tests can reveal anemia, which sometimes occurs with advanced cancer. Comprehensive metabolic panels can show changes in kidney function, liver function, and other body systems that might be affected by cancer or its spread. Some men also undergo more advanced testing like the 4K score test or the Prostate Health Index, which combine multiple blood markers to provide a more comprehensive picture of prostate cancer risk. These tests can help doctors determine whether a biopsy is necessary and can provide more precise risk assessment than PSA alone. Here's what's crucial to understand about all this testing. These are tools that work best when used consistently over time by healthcare providers who understand how to interpret the results in the context of your individual health profile and symptoms. This is why establishing a relationship with a qualified healthcare provider and maintaining regular checkups is so important. The most important thing you can do right now is to start tracking your PSA levels if you haven't already. If you're over 50 or over 45, if you have risk factors like family history or African American heritage, you should be having this conversation with your doctor. Don't wait for symptoms to appear. By then, you've missed the window for the easiest and most effective treatment options. In our next section, I'm going to share with you the risk factors that significantly increase your chances of developing prostate cancer, including some that might surprise you. Understanding these risk factors will help you determine how aggressively you should be monitoring for the warning signs we've discussed. This information could help you take control of your health in ways you never imagined. Let's discuss the risk factors that dramatically increase your chances of developing prostate cancer, because understanding your personal risk level will help you determine how seriously you should take the warning signs we've been discussing. Some of these risk factors might surprise you, and some are more controllable than you might think. Age is the single most significant risk factor for prostate cancer. Here's a statistic that might shock you. While only about 1 in 350 men under age 50 will develop prostate cancer, this increases to 1 in 52 for men in their 60s and 1 in 19 for men in their 70s. This dramatic increase with age is why screening recommendations typically begin at age 50 for men at average risk. But age isn't the only factor. Family history plays a crucial role that many men underestimate. If your father or brother had prostate cancer, your risk is more than doubled. If multiple family members have been affected, or if they were diagnosed at a young age, your risk increases even more significantly. What's particularly important is that this family history risk applies to both sides of your family. Your mother's family history is just as relevant as your father's. Race and ethnicity create significant differences in prostate cancer risk that every man needs to understand. African American men have the highest risk of prostate cancer of any racial or ethnic group. They're about 70% more likely to develop prostate cancer and are more than twice as likely to die from it compared to white men. This increased risk means that African American men should begin screening discussions with their doctors at age 45 rather than 50. Geographic location and environmental factors also play a role that's often overlooked. Men living in northern climates have higher rates of prostate cancer, possibly related to lower vitamin D levels from reduced sun exposure. Industrial workers, farmers and men exposed to certain chemicals like Agent Orange during military service also have elevated risks. Diet and lifestyle factors represent some of the most controllable risk factors, yet they're often ignored. Men who consume diets high in red meat and high-fat dairy products have increased prostate cancer risk. Conversely, diets rich in vegetables, particularly tomatoes and other foods containing lycopene, may be protective. The Western diet, high in processed foods and low in fresh fruits and vegetables, appears to increase risk significantly. Obesity is another controllable risk factor that's becoming increasingly important. Men who are significantly overweight have higher rates of aggressive prostate cancer and are more likely to die from the disease. The relationship between obesity and prostate cancer is complex, involving hormone levels, inflammation, and other metabolic factors. Physical activity levels also influence risk in ways that might surprise you. Regular exercise appears to be protective against prostate cancer, particularly vigorous exercise. Men who exercise regularly have lower rates of aggressive prostate cancer and better outcomes if they are diagnosed. Even moderate exercise, like brisk walking for 30 minutes several times per week, can provide protective benefits. Hormone levels, particularly testosterone, play a complex role in prostate cancer development. While low testosterone doesn't prevent prostate cancer, very high levels may increase risk. Men who have used testosterone replacement therapy or anabolic steroids may have altered risk profiles that need to be discussed with their healthcare providers. Smoking significantly increases the risk of dying from prostate cancer, even though it may not increase the risk of developing it initially. Smokers who develop prostate cancer are more likely to have aggressive forms of the disease and are more likely to experience cancer recurrence after treatment. Here's something that many men don't realize. Having had a vasectomy does not increase prostate cancer risk, despite some older studies that suggested it might. Current research clearly shows that vasectomy is not a risk factor for prostate cancer. Sexual activity patterns and sexually transmitted infections may also influence risk, though the research is still evolving. Some studies suggest that men with higher numbers of sexual partners or certain sexually transmitted infections may have slightly increased risk, while other research suggests that regular ejaculation may be protective. Understanding your personal risk profile is crucial because it determines how aggressively you should monitor for warning signs and when you should begin screening discussions with your healthcare provider. Men with multiple risk factors might benefit from earlier and more frequent screening, while men with lower risk profiles might follow standard screening guidelines. The most important thing to understand is that having risk factors doesn't mean you will definitely develop prostate cancer, just as having no risk factors doesn't guarantee you won't. But understanding your risk helps you make informed decisions about monitoring, lifestyle changes, and medical care. In our next section, I'm going to share with you exactly what you should do if you recognize any of these warning signs, including the specific questions you should ask your doctor and the tests you should request. This information could be the difference between catching cancer early when it's most treatable and missing the opportunity for the best possible outcomes. Now that you understand the warning signs and risk factors, let's talk about exactly what you should do if you recognize any of these symptoms in yourself. This action plan could literally save your life, so please pay close attention to every detail I'm about to share with you. First, and most importantly, do not wait to see if symptoms go away on their own. One of the biggest mistakes men make is adopting a wait-and-see approach when they notice potential warning signs. Prostate cancer is most treatable when caught early, and delays in diagnosis can significantly impact your treatment options and outcomes. When you contact your healthcare provider, be specific and detailed about your symptoms. Don't just say, "I'm having some bathroom problems." Instead, describe exactly what you've noticed. "I've been getting up 3 times every night for the past 2 months to urinate, and my urine stream seems much weaker than it used to be." This specificity helps your doctor understand the urgency and directs them toward appropriate testing. Here are the specific questions you should ask your healthcare provider. What is my current PSA level, and how does it compare to my previous tests? Based on my symptoms and risk factors, do you recommend a prostate examination? Should I see a urologist for further evaluation? What additional tests might be appropriate for my situation? Don't be afraid to advocate for yourself and ask for referrals if you feel your concerns aren't being taken seriously. The initial evaluation will likely include a digital rectal examination, which I know many men find uncomfortable to discuss. However, this simple examination allows your doctor to feel your prostate gland and check for irregularities in size, shape, or texture. While it's not the most comfortable experience, it provides valuable information that can't be obtained through blood tests alone. If your PSA is elevated, or if you have concerning symptoms, your doctor might recommend additional testing. This could include a urine test to rule out infections, imaging studies like an ultrasound or MRI, or ultimately a prostate biopsy if other tests suggest the possibility of cancer. Understanding these potential next steps can help you mentally prepare and ask informed questions about each test. Here's something important about timing. If you're experiencing any of the urinary symptoms we discussed, try to avoid sexual activity for 48 hours before your PSA test, as ejaculation can temporarily elevate PSA levels. Also, avoid vigorous exercise or activities like cycling that might affect your prostate for a day or two before testing. Don't let embarrassment or fear prevent you from seeking medical attention. Remember that your healthcare provider has seen and heard about these symptoms many times before. They're trained to discuss these issues professionally and without judgment. Your health is far more important than any temporary discomfort you might feel discussing these symptoms. If you don't currently have a primary care physician, this is the time to establish that relationship. However, don't let the process of finding a doctor delay your evaluation if you're experiencing concerning symptoms. Walk-in clinics, urgent care centers, or even emergency rooms can perform initial evaluations and PSA testing if necessary. Consider bringing a trusted family member or friend to your appointments, especially if you're feeling anxious or overwhelmed. They can help you remember important information, ask questions you might forget, and provide emotional support during what can be a stressful time. Keep a symptom diary for a week or two before your appointment. Note when symptoms occur, their severity, and any patterns you notice. This information can be incredibly valuable for your healthcare provider and helps ensure you don't forget important details during your appointment. Be prepared to discuss your family history in detail. Know which relatives have had prostate cancer, their ages at diagnosis, and their outcomes if possible. This information significantly influences your risk assessment and screening recommendations. If initial tests suggest the possibility of cancer, don't panic, but do take the situation seriously. Modern treatment options for prostate cancer are more effective than ever before, especially when the cancer is caught early. Ask your doctor about referrals to specialists and about getting a second opinion if you feel it would be helpful. Here's something crucial. If you're diagnosed with prostate cancer, treatment decisions should never be rushed unless there's a medical emergency. Take time to understand your options, ask questions, and make informed decisions about your care. The vast majority of prostate cancers grow slowly enough that you have time to make thoughtful treatment decisions. In our next section, I'm going to share with you the latest treatment options and breakthroughs in prostate cancer care that give men better outcomes than ever before. This information will help you understand that a prostate cancer diagnosis, while serious, is no longer the devastating news it once was. The advances in treatment are truly remarkable, and understanding these options could give you hope and confidence in facing this challenge. Let's discuss the remarkable advances in prostate cancer treatment that have revolutionized outcomes for men diagnosed with this disease. What I'm about to share with you should give you tremendous hope because the treatment landscape for prostate cancer has changed dramatically in recent years, offering men better outcomes with fewer side effects than ever before. First, let's talk about active surveillance, which has become an increasingly important option for men with low-risk prostate cancer. This approach involves careful monitoring rather than immediate treatment, recognizing that many prostate cancers grow so slowly that they may never become life-threatening. Active surveillance includes regular PSA testing, periodic biopsies, and sometimes advanced imaging to track any changes in the cancer. The beauty of active surveillance is that it allows men to avoid the potential side effects of treatment while maintaining excellent cancer control. Studies have shown that men on active surveillance have the same long-term survival rates as men who choose immediate treatment, but without the quality of life impacts that can come with surgery or radiation. For men who do need active treatment, surgical options have advanced tremendously. Robotic-assisted laparoscopic prostatectomy has largely replaced traditional open surgery in many centers. This minimally invasive approach uses sophisticated robotic technology that allows surgeons to operate through small incisions with enhanced precision and visualization. The benefits of robotic surgery are significant. Smaller incisions mean less pain, shorter hospital stays, faster recovery, and often better preservation of urinary and sexual function. Many men are able to return to normal activities within weeks rather than months, and the precision of robotic surgery often results in better cancer control with fewer complications. Radiation therapy has also seen remarkable advances. Modern techniques like intensity-modulated radiation therapy and stereotactic body radiation therapy allow doctors to deliver precise doses of radiation directly to the prostate, while minimizing exposure to surrounding healthy tissues. Some men can now complete their entire radiation treatment in just 5 sessions rather than the traditional 40+ sessions. Brachytherapy, or seed implantation, represents another sophisticated radiation option. This technique involves placing tiny radioactive seeds directly into the prostate tissue, delivering concentrated radiation to the cancer while sparing nearby organs. The seeds remain permanently in place but become inactive over time. For men with more advanced prostate cancer, hormone therapy has become much more sophisticated and effective. Modern hormone treatments can significantly slow cancer progression and extend life while maintaining quality of life. These treatments work by reducing testosterone levels or blocking testosterone's effects on cancer cells. Newer hormone therapy medications like abiraterone and enzalutamide have shown remarkable effectiveness even in advanced cases. These medications can often control cancer for years, allowing men to maintain active, fulfilling lives despite their diagnosis. Immunotherapy represents one of the most exciting frontiers in prostate cancer treatment. These treatments harness your body's own immune system to fight cancer cells. Sipuleucel-T, an immunotherapy specifically approved for prostate cancer, has shown the ability to extend survival in men with advanced disease. Chemotherapy for prostate cancer has also become more effective and better tolerated. Modern chemotherapy regimens can significantly extend life and improve symptoms in men with advanced cancer, often with manageable side effects that don't prevent men from maintaining their normal activities. Perhaps most exciting are the targeted therapies that are being developed based on our growing understanding of the genetic changes that drive prostate cancer. PARP inhibitors, for example, have shown remarkable effectiveness in men whose cancers have certain genetic characteristics, sometimes shrinking tumors dramatically, even in advanced cases. Clinical trials are continuously testing new treatments and combinations of treatments, Participating in a clinical trial can give men access to cutting-edge therapies that aren't yet widely available, often at no cost and with careful monitoring by leading cancer specialists. The multidisciplinary approach to prostate cancer care has also improved outcomes significantly. Today's best cancer centers bring together urologists, radiation oncologists, medical oncologists, pathologists, radiologists, and other specialists to develop personalized treatment plans for each patient. This team approach ensures that every aspect of your care is coordinated and optimized. Your treatment team considers not just your cancer characteristics, but also your age, overall health, personal preferences, and quality of life priorities when developing your treatment plan. Genetic testing of both you and your tumor has become an increasingly important part of treatment planning. Understanding the specific genetic changes in your cancer can help doctors predict which treatments are most likely to be effective and can identify men who might benefit from newer targeted therapies. The focus on preserving quality of life during and after treatment has also improved dramatically. Modern treatments are designed not just to control cancer, but to help men maintain their urinary function, sexual function, and overall well-being. Rehabilitation programs, including pelvic floor physical therapy and sexual health counseling, are now standard parts of comprehensive prostate cancer care. Support services have also evolved to address the emotional and psychological aspects of a cancer diagnosis. Many cancer centers now offer support groups, counseling services, nutritional guidance, and integrative therapies that can help men and their families cope with the challenges of cancer treatment. What's particularly encouraging is that the 5-year survival rate for men diagnosed with localized prostate cancer is now nearly 100%. Even for men diagnosed with regional or distant metastases, survival rates have improved significantly and continue to get better as new treatments become available. The key message here is that a prostate cancer diagnosis, while serious, is no longer the devastating news it once was. With early detection and appropriate treatment, the vast majority of men diagnosed with prostate cancer will live long, healthy lives. Many will die with prostate cancer, not from it, living full lifespans with their cancer well controlled. In our final section, I'm going to give you a comprehensive action plan that summarizes everything we've discussed and provides you with specific steps you can take right now to protect your health. This summary will ensure you don't miss any crucial information and will give you the confidence to take control of your prostate health starting today. Now, let's bring together everything we've discussed into a comprehensive action plan that you can implement immediately to protect your health and potentially save your life. This final section is crucial because knowledge without action won't help you. You need to take specific steps based on what you've learned today. If you're over 50 or over 45, if you have risk factors like family history or African American heritage, your first step should be scheduling a comprehensive discussion with a healthcare provider about prostate cancer screening. Don't wait for your annual physical. Make this appointment specifically to discuss prostate health and establish baseline measurements. During this appointment, request a PSA test if you haven't had one recently, and ask your doctor to explain your results in detail. Make sure you understand not just your current PSA level, but how it compares to previous tests and what changes might be concerning in the future. Request copies of all your test results so you can track trends over time. Start paying attention to your body's signals immediately. Keep a simple log for the next 2 weeks, noting any urinary symptoms, how often you urinate during the day and night, the strength of your urine stream, any difficulty starting or stopping, and whether you feel like you're completely emptying your bladder. This information will be invaluable for your healthcare provider. Be honest with yourself about any sexual health changes you've noticed. While these topics can be uncomfortable to discuss, they're crucial warning signs that shouldn't be ignored. If you've noticed blood in your semen, changes in erectile function, or pain during ejaculation, these need immediate medical attention. Pay attention to unexplained bone pain, particularly in your lower back, hips, or pelvis. If you're experiencing persistent pain in these areas that doesn't respond to typical treatments or doesn't have an obvious cause, mention this specifically to your healthcare provider as a potential concern related to prostate health. Monitor your overall health for signs like unexplained fatigue, unintentional weight loss, or changes in appetite. While these symptoms can have many causes, when they appear alongside other warning signs, they become more significant and warrant prompt evaluation. Take control of the risk factors you can influence. If you're overweight, begin a sensible weight loss program with guidance from your healthcare provider. Increase your physical activity. Even moderate exercise like brisk walking can provide protective benefits against prostate cancer. Evaluate your diet and make improvements where possible. Increase your consumption of vegetables, particularly tomatoes and other foods rich in lycopene. Reduce your intake of red meat and high-fat dairy products. Consider discussing nutritional supplements with your healthcare provider, as some studies suggest certain supplements might be beneficial for prostate health. If you smoke, make quitting a priority. Smoking significantly worsens outcomes for men who develop prostate cancer, so quitting can improve your prognosis even if you're already diagnosed. Your healthcare provider can help you develop a quitting plan and provide resources to support your efforts. Build a healthcare team you trust. If you don't have a primary care physician, establish that relationship now. Consider whether your current healthcare provider is knowledgeable about men's health issues and comfortable discussing prostate health. Don't hesitate to seek referrals to specialists if you have concerns. Educate your family about your risk factors and encourage other men in your family to be proactive about their prostate health. Share what you've learned today with your sons, brothers, and male friends. You could literally save someone's life by encouraging them to pay attention to warning signs. Create a prostate health monitoring schedule for yourself. Plan to have PSA testing annually or as recommended by your healthcare provider. Mark these appointments in your calendar and treat them as non-negotiable commitments to your health. If you experience any of the warning signs we've discussed, don't delay seeking medical attention. Remember that prostate cancer is most treatable when caught early, and delays in diagnosis can significantly impact your treatment options and outcomes. Stay informed about advances in prostate cancer research and treatment. The field is evolving rapidly, and new treatment options are continuously being developed. Subscribe to reputable health newsletters or websites that provide updates on men's health and prostate cancer research. Finally, remember that taking action based on this information is not about living in fear. It's about taking control of your health and giving yourself the best possible chance for a long, healthy life. The warning signs and risk factors we've discussed are your body's early warning system, and understanding them gives you the power to catch problems early when they're most treatable. The most important thing you can do right now is to commit to taking your prostate health seriously. Make that appointment, start paying attention to your body's signals, and don't ignore warning signs. Your future self will thank you for the proactive steps you take today. Remember, modern medicine has given us incredible tools for detecting, monitoring, and treating prostate cancer. Men who are diagnosed today have better treatment options and better outcomes than ever before in history. By staying informed, being proactive, and working with qualified healthcare providers, you can take control of your prostate health and protect your future. The information you've learned today could be life-saving. Don't let it go to waste. Take action, stay vigilant, and prioritize your health. Your life and the lives of the men you care about may depend on it.